Welcome to Nursing Right Now, your daily dose of nursing and medical knowledge.
3 simple steps for interpreting arterial blood gas.
Here are the 3 components to take notes and their normal values. The pH level, PCO2 or partial pressure of carbon dioxide, and HCO3 or bicarbonate. But first, we need to know, what is arterial blood gas test? We use ABG test to check for acid-base balance and to measure dissolved oxygen and carbon dioxide. This test is also used to diagnose and manage respiratory and metabolic disorders. How is ABG test done? By taking a blood sample from an artery, mostly from a radial artery, but femoral artery is sometimes used. It can also be taken from arterial line, usually in ICU patients. The first thing to remember is the pH, which measures the acid-base balance in our body or simply determines the acidity and alkalinity of your blood. The normal value of pH is 7.35 to 7.45. For example, a blood pH level of 7.30 is acidic, while a pH level of 7.47 is alkalotic. PaCO2 measures partial pressure of carbon dioxide in your arterial blood. Carbon dioxide is controlled by the lungs and is the respiratory indicator. The normal is 35 to 45. Remember, the higher the carbon dioxide in your body, the more acidic your blood. HCO3 measures bicarbonate concentration in arterial blood. The normal value is 22 to 26. Bicarb, on the other hand, is controlled by your kidneys and is the metabolic indicator. How to interpret arterial blood gas results in 3 simple steps. Step number 1. Determine the blood pH level. The normal value is 7.35 to 7.45. If pH is below 7.35, then it is acidosis. If it is above 7.45, then it is alkalosis. Step number 2. Identify the PaCO2 level. The normal value is 35 to 45. If PaCO2 is going opposite direction with pH, then it is a respiratory problem. If not, then proceed to step number 3. Note: PaCO2 goes directly opposite with pH. Step number 3. Check the bicarb level. The normal value is 22 to 26. If HCO3 is going in the same direction as pH, then it is a metabolic problem. Note: HCO3 is directly proportional to pH.
Now, let's try to answer some examples of arterial blood gas results, using our 3 simple steps of interpreting ABG.
Patient 1 has an arterial blood result of pH of 7.30, PaCO2 of 52 and HCO3 of 24. Step 1. Check for the pH level. The pH level is decreased, which reflects acidosis. Step 2. Check for PaCO2. Carbon dioxide is elevated, which reflects an opposite relationship with the pH. Therefore, the condition is a respiratory imbalance. Step 3. Check the bicarb level. HCO3 is 22, which is within the normal value. As pH is decreased and carbon dioxide is elevated, therefore the interpretation is respiratory acidosis. Example number 2. Step 1. Check for the pH level. The pH level is decreased, which reflects acidosis. Step 2. Check for PaCO2. Carbon dioxide is within the normal value. Step 3. Check the bicarb level. HCO3 is decreased, which reflects a corresponding relationship with the pH or same direction with the pH. Therefore, the condition is a metabolic imbalance. As both pH and HCO3 are decreased, the interpretation is metabolic acidosis. Example number 3. Step 1. Check for the pH level. The pH level is elevated, which reflects alkalosis. Step 2. Check for PaCO2. Carbon dioxide is decreased, which reflects an opposite relationship with the pH. Therefore, the condition is a respiratory imbalance. Step 3. Check the bicarb level. HCO3 is 25, which is within the normal value. As pH is elevated and carbon dioxide is decreased, therefore the interpretation is respiratory alkalosis. In summary, we discussed about the normal values of pH, carbon dioxide, and bicarb. Also, the 3 easy steps of interpreting the arterial blood gases.
Thank you for watching Nursing Right Now. For more nursing and medical knowledge, please don't forget to subscribe and watch our latest and previous videos. You can also follow us on Instagram and check out our informative posts. Have a great day.